Welcome back, everyone. Texas is running low on a certain type of COVID-19 antibody treatment. The Department of State Health Services issued a statement on Monday saying that antibody infusion centers in Austin and several other cities are now out of a treatment that can help keep Omicron patients out of hospitals. KVUE's Hannah Rucker spoke with the Texas Medical Association about what happens now.
Joining me now is Dr. Mark Casanova with the Texas Medical Association to talk a little bit more about this. Dr. Casanova, thank you so much for taking the time. I know a lot of people have questions right now. Let's talk a little bit about this specific antibody treatment. It's called sotrovimab. What makes that different from other antibody treatments that doctors have used throughout this pandemic?
So the other antibody treatment that most of us are familiar with is Regeneron. That was the first monoclonal antibody therapy that we had available against COVID. If you think about what these monoclonal antibodies do in relationship to the spike protein, they recognize the spike protein and essentially block it, preventing it from entering the cell, replicating, and carrying on the infection. With the mutation that Omicron has experienced, if you envision a spike protein like a tree with a branches and leaves, the leaves and the branches have changed enough that Regeneron is no longer effective. The good news is that they haven't changed so much and the trunk of the tree has remained the same, so that sotrovimab still recognizes it and is effective against this Omicron strain.
We heard earlier this month that Omicron cases were sometimes less severe than some of the other variants we've been seeing. Is that still true right now?
It appears so, but we need to caution with that interpretation. One factor could be the fact that we do have a decent number of individuals who are in fact fully vaccinated and boosted. Therefore, it stands to reason their infections will be less severe. The other factor is it's a pure mathematics related issue. If only 10 individuals out of 100 have more severe infections and land in the hospital, say they're unvaccinated, but you increase the rate of infection by 10-fold, now you have 100 individuals that are needing to be hospitalized. So this is all really coming down to a numbers game at this time. Generally speaking, the infections are less severe. However, if you increase that by 10, 20, 30-fold, you're going to see an increased subset of individuals who still require hospitalization.
The timing of this, we just wrapped up Christmas. We have New Year's Eve. A lot of people are kind of planning to get it back out there. Do you have concerns with this as you see patients locally?
We do, and this couldn't have been worse timing, even if the Scrooge wrote this playbook. So, again, not to burst bubbles and pull away hopes and aspirations for a vibrant celebratory New Year's, but we really do want folks to be mindful, be careful, be thoughtful about the settings that you're going to be in if you're not vaccinated. And certainly, if you happen to be sick right now, please don't expose yourself to others. So I think we've got probably another pretty rough 3 to 4 weeks ahead of us.
Thank you so much. Some great tips there. We so appreciate the work you're doing. I know it's been a tough 2 years. Dr. Mark Casanova with the Texas Medical Association there. Thank you so much for joining us here on KVUE.